let's move on because we have important stuff to talk about. We are so excited today to be welcoming a longtime online friend, an amazing activist, Scott Desnoyers. We are bringing you on and thrilled to have you here. How are you today?
I'm doing great. Thank you so much for having me on. You both know how important this is to me, so I cannot tell you how much I appreciate it. And I also, in the very start, I want to thank everybody that's fighting for universal health care. I've used the hashtag No One Fights Alone, and I appreciate every single one of us that's fighting along together.
Same.
Amen. And last time I saw you, Scott, we actually met in the real world for a change. We were outside Nancy Pelosi's house with Cole Washington and the protests there.
Yeah, that was an amazing event. Yeah, we had brought that coffin with us that symbolized the 68,000 lives a year we lose to our for-profit healthcare system.
That's right, which is devastating. And that was before COVID. And now they're saying about a third of the COVID deaths are because we don't have that. So we're up close to 400,000 preventable deaths. I know a lot of people online do know you, but could you just tell us something about your story, how you came to this fight, and then we'll talk about what your plans are for the upcoming, your date on April 9th.
Thank you. Most people aren't aware that I actually got involved slightly in 2016 when I heard Nina Turner, speaking about our healthcare system. And because I tell you, if I'd actually heard Bernie, I probably would have ignored just another old white guy on the news, Right. But Nina spoke with such heart and conviction. She actually compelled me for the first time in my life to register and vote. And I think I was 46 at the time or something like that, 48, something like that. But anyway, so after Bernie turned around and endorsed Hillary Clinton, I was like, yeah, whatever. And I just got totally uninterested, right? Yeah. Until 2019. And that's when things got real for me. In 2016, I fought for my own healthcare because I could spend an entire 2 hours on my own healthcare. As you had mentioned before the show, I just got out of the hospital for my health condition that I had. But it was not for me that I fight this hard for. It was just about 4 years ago, almost exactly, maybe a week or two away, that my 29-year-old son had come in the door. He'd been living with me for about a month. And he goes, Pops, I went to get my medication refilled today and found out that my insurance had been canceled. I'm like, okay, Danny, it's not a big deal. I mean, how much is it? And he tells us it was $250. And that is a big deal because I don't have $250 today to spend on Danny's medication. Knowing the results, I dig a lot harder. But it's like, okay, Danny, well, you have an appointment with your therapist in a couple of weeks, and I'm sure she can help you out. But in the meantime, you need to get a hold of FidelisCare and find out what's going on. FidelisCare is a managed Medicaid program along with two other major corporations here in New York, and was providing Danny his Medicaid prescription drugs. The medication he was on was risperidone, which has a known suicidal risk upon withdrawals. Well, we didn't get his medication, and it was on April 9th of 2019 that I read his suicide note on Facebook. And he says, I just wanted everybody to know that I love them. I'm saying goodbye. This world wasn't meant for me. Maybe the next life will be better. I super glued my seatbelt, double checked. I don't have the strength to open it, and I choose death by drowning because I can't get above this pain. I'm sorry for hurting those who care. This is selfish, I'm sure. But I've been staring at the water for hours, and I've made my decision. Daniel and Hazel, his children, I'm so fucking sorry. And he drove his truck into the Mohawk River that day. When I saw his post, he showed the cab of his truck overlooking the water. And I lived 5 minutes from Saratoga Lake, and Danny was living with me at the time. So I, of course, assumed that's where he was. And I jumped in my car, and I raced down to the lake after screaming to my wife what was going on. And I was racing around that lake looking for mud, water, bubbles rising up, anything. After about 20 minutes, I realized I had to turn around and go back and tell my wife that our boy was dead because he missed a $20 payment. Oh, wait, he was late making his $20 payment because he actually called up and found out he was missing that $20 and made the payment on the phone that day. And they told him his plan would be reinstated on the next billing cycle of May 1st. I vowed at Danny's funeral that I will make our lawmakers look me in the eye and see the consequences of their decisions. I wasn't known on Twitter at that point. I didn't know how I was going to make that promise. But I've been fulfilling that promise, and I will continue to fulfill that promise. Because I've heard so many other stories. I mean, sure, we've all heard about Amy Villelda's daughter, Shalyn. You know, she lost her daughter in a very similar way. Shalyn went to go get checked out, and they said these tests cost thousands of dollars, and you don't have it because you don't have insurance. Now, Amy has to live every day like I do, waking every morning knowing her daughter is gone forever. It's something we don't forget. All 68,000, 400,000, they all had parents. They're all somebody's children, whether they're 92 or 5 or even a stillborn child. It hurts, and it continues to hurt. That's why I'm asking everybody to join in this fight. We can't, just because the leaders have gone quiet, doesn't mean that us, Bernie said, not me, us. I can't believe that the man spoke for 40 years about healthcare and justice and then suddenly decided to become quiet when he got on Biden's staff.
Yeah, it's pretty disappointing.
Because he knew if he got in a place like that, it would still be on us. So just because our leaders have been quiet doesn't mean that we have to be quiet. And I won't. I will not. And on April 9th of this year, I'm bringing it to Fidelis front doors, their executive office in New York City. The founder of FidelisCare is a father, Patrick Frawley, an ordained priest of the Brooklyn Catholic Diocese. The man sold FidelisCare to Centene, the biggest beneficiary of the ACA's managed Medicaid program, to Centene for, $3.9 billion as a priest, and he still wears the collar. He then landed the nice cushy job of VP, get this, social responsibilities of Centene for $5.9 million a year to deny Medicaid patients the health care that they need to live. How godly.
Yeah.
I also failed to mention, not only is April 9th this year the 4th anniversary of us losing Danny, it's also Easter Sunday. I've been cast in a documentary with many of the Red Berets for Medicare for All called Healing Us. Yeah. And many of them are showing up in this action in New York City in solidarity with me. This documentary has been narrated by Susan Sarandon and soon be released. I'll share the link in the thread later on.
Great, and we'll share it under our YouTube also, definitely. Yeah.
Thank you.
I just want to say, I've already had an opportunity to watch the movie. It's phenomenal. You get to tell your story, and there are so many other stories, and you really come away with it understanding just how our whole medical system is about profit. It has nothing to do with saving people at all.
It is atrocious, and
it
really, I watched it. I finally got a chance also last night to watch it, and it's beautiful and so heartbreaking. And the resolve and fortitude that you all have for continuing this fight for all of us. And I mean, it is such a little comfort. I am just so sorry for you and your family, and for what they did to Danny is horrific. I'm so sorry.
Thank you. I'd like to bring out that in this action, we have a 2-path objective here. We want a national, single-payer, universal healthcare system that covers everybody at the time of service free. Nobody has to worry about bills. No insurance companies involved. National. I want to make that sure that's clear, because this action is fighting for national, single-payer, universal healthcare. Call it Medicare for all. Call it whatever you want to call it. But yes, national. However, we're also at this action calling to pass the state legislation called the New York Health Act, which is a state-based single-payer universal health care for everybody within New York borders. If you're a resident, you get health care free at the time of service, regardless of your ability to pay for it. We believe that with our current administration at the federal level, there is no way we are going to get the Medicare for All bill through the House and the Assembly and get Joe Biden to sign that bill. We all know this. That doesn't mean we stop fighting for it. However, we have the votes in New York to pass it through the Assembly. It's already passed 4 times, and in the Senate. The only reason it didn't pass, I would assume, has something to do with the $250,000 that Andrea Cousins, the Senate Majority Leader, has accepted from the healthcare industry, or the 2 senators that went to Andrea Cousins and said, do not call this bill for a vote because we don't support it. Maybe that has something to do with it. So we need to keep the pressure on these legislators, and we can actually get this done in a couple of states. We can get this done in California. We can get this done in Washington. We can get this done in Massachusetts. And now there's even a single payer bill in Utah that is being written by, and you'll see this in the documentary, by a conservative in Utah, saying because it is the right thing to do on a financial basis, conservatively speaking.
Yeah. I mean, it is. And if that's the only thing that gets some people to the table, it's worth it. But how gross it has to be that. But yes, I know that you guys have gotten some pushback from people for trying to get it through on the states, but I don't want to badmouth or malign anyone. I don't understand not doing exactly what you all are doing and supporting you to fight on all fronts, because you're right. If we keep waiting for this to happen on a federal level, we will all be long gone. It's never going to happen. So when you take your activism to the streets and on these local levels, state levels, you are fighting for the whole country by doing that. So thank you.
And on that message, I say this documentary that we're talking about is called Healing Us. And for those that disagree with our state-based direction, that's fine. I'm okay with that. Please fight alongside of us for national then, and stop objecting to what we're doing on state-based legislation. We can work together where we have common grounds. We don't have to fight against each other when we are allies.
100%. It is a beautiful documentary. We have been talking with Laura Fielding also. We would love to highlight the documentary, some parts of it on our show, and have her on as well. We're so grateful and inspired by what you're doing. So thank you.
And thank you guys too. I appreciate everybody who said I knew right from the start. I had no idea what I was doing. I have no idea how to put an event together like that. We've got amazing speakers coming in from all over the country, organizing going on, and I am so unorganized. I have no idea what I'm doing. I'm good at making this imagery behind me, and that's about it. And I can talk about my pain. So thank you, everybody that helps me so much.
Well, Scott, you're amazing. We do have the flyer, but we'll link to everything, and feel free to add to the thread. Sorry, this blocked you. This is so embarrassing. We don't have a great setup, but this is the flyer. I think it's already attached to this, but we'll add it and make sure that we've got all of the information for anybody who wants to join up with you all and support you in any way they can. Please keep staying safe and healthy yourself. We need you out there. We're so grateful to you.
You know the cobbler's kid had no shoes, right? Everybody's healthcare is important, but mine.
I'm going to reject.
I will take care of myself.
Wrap you in a bubble and preserve you at all costs. You are a national treasure. Scott, thank you so much for joining us. Good luck, and we'll have you back on. We'd love to hear about how it goes. April 9th, everyone. And again, we'll put that in our description under the show.
Good night, everybody.
Amen.
Thank you.
And I just want to say thank you, Scott. I know retelling your story, it breaks me up every time I hear it, and I can see you going through it. And that's your sacrifice for other people.
Yeah.
And it's not going unnoticed. We love you, man.
Thank you, brother. Good night.
Thank you. Good night. Thank you so much.